And now it's my pleasure to introduce Candace Anderson, who's been here on all 19 of our broadcasts, giving us an update. A lot's going on. There's a lot of information. So we actually expanded the time for Candace this morning to go into sort of what's going on and what to expect over the next 2 to 3 weeks and the nuances that are involved in that change that's going on. So Candace, thank you for being here again.
My pleasure. It's always fun to be here with you, Bill. And so let's talk about where we are now. And so as Steve mentioned, as I know everyone was really anxiously awaiting, we did move into the red tier. And just to remind you, there is a state tier system. Purple is the highest, where it's most considered widespread, and that's where we started out. And that meant that we had more than 7 cases per 100,000 people on average per day, and that we had a positivity rate of more than 8%. Luckily, our positivity rate was consistently well below that. It met the red tier standard, but we were hovering right around that 6 to 7%, a little bit over cases per 100,000. We, for 2 weeks in a row, beat that. So to move down to the next tier, the less restrictive tier, you need to be in the new tier for 3 weeks. So guaranteed we will stay in the red tier for a minimum of 3 weeks. And then if we want to move down to the orange tier, we will need to meet the orange tier's standards for 2 weeks. And so in comparison, in the red tier, we are supposed to have 4 to 7 cases per 100,000 people per day, and our positivity rate should be somewhere between 5 and 8% in the red tier. To go into the orange tier, we need to drop down to 1 to 3.9 cases per 100,000 and 2 to 4.9% of positive cases. And so right now we are not quite even meeting the orange tier's requirements. We are currently at about 6.3% of cases, 6.3 cases per 100,000. Our positivity, though, is right now about the 3.7% positivity. So once again, positivity looks okay, but our cases are not quite there at this time. Now, the new wrinkle in all of this is that the governor announced this week that there is going to be a social equity provision that is also added, and it's going to take effect next week as you start looking at moving from tiers. And essentially what it's saying is we also need to look at, in a county such as ours, our disadvantaged communities. And this is the lowest quartile of our health index. We're supposed to be getting a graph out hopefully today on our own website of what those communities are, but they also need to meet the positive percent case standards. Because while on average we are doing well, we've got a countywide 3.7% case, positive cases, we are in some of our more disadvantaged communities, Richmond, San Pablo, Bay Point, parts of the Monument Corridor, we're hovering closer to 7% in those areas. And so what the state is saying, you've got to bring down those areas too. Now, they're not saying you have to bring it all the way down to be the exact same average, but in our case, it would need to be down to about 5.2% case positives before we could start qualifying to go into the orange level. And so that's something that has been challenging for especially large urban counties such as ours, where you've got 19 different cities, you've got a lot of social justice issues, a lot of health inequity issues that have been going on for a very, very long time. And it is challenging in the middle of a pandemic to try to address those as well. But it's something we have been working on for a very long time in this pandemic. We started seeing within 3 months into the pandemic that the cases were very much higher in these communities. And a large part is because these individuals don't have the luxury to work from home. Many of them have been frontline workers. They come out and they work in our communities. They work throughout the county. Many of these individuals live in families where they have multiple families in the same residence. There's been some language barriers. And so from day one, I was even filming some, Spanish, not that my Spanish is that great, but some ads in Spanish, doing more outreach. And so we've really come up with a much, much more comprehensive approach to this. And in fact, the state, starting October 6th, wants each county to outline exactly what their plan is to address these communities. And so what we're also doing is some of the things that we've already started doing is we've been doing more testing. We set up last 2 months, we've been setting up additional testing, more just walk-in testing where you don't have the barriers of trying to make an appointment. We've been working with our health partners in those communities. Beyond our regular healthcare providers, we've got places like La Clinica. We have some other healthcare providers that treat individuals regardless of their citizenship. We have been working with combining testing with flu shots, doing more outreach through what we call our ambassadors, which in often case are youth, others who are more in tune with individuals in there. We're working with what we call our trusted partners, and these are people that individuals in a community trust. It might be a pastor at a church. It might be a community organizer that they regularly work with. It's someone that they trust for information. We are doing a Bay Area wide, all of the health officers through their public information officers, more outreach in different languages. We're making sure that people realize that if they in fact become positive for COVID, they in fact have a place where they can quarantine. We do have, hotel beds that are still available, not just for our homeless population that we've been housing, but it also is for those individuals who don't have room in their home to self-isolate if in fact they test positive. We're also working, and when I say enforcement, because as you all know, we did go ahead and pass an administrative enforcement ordinance a couple of months ago, but we're really working on those areas where we're seeing extreme violations. For example, if a bar is open and it's encouraging people to gather. I'm not talking about going down the street and doing face mask violations, but in fact, in those communities where we're seeing people congregate and potentially spreading the virus, we're working with that as well. And so those are really important things. I think one thing I'm really trying to be very cautious of is not putting it in the lens of it's them versus us, because that is not the case. We track our COVID cases based upon where someone resides, not where they work. And so many of the individuals who are coming down with COVID may very well be contracting in our own communities as opposed to in their own. And so we're trying very hard to avoid some stigmatization of those cities, those communities where there's a higher amount, because it's spreading within all of our communities. And we all need to continue to take the measures, the very important measures that we need to take. Now let's go on to the good news, because we did enter into the red tier. And as I was hearing this whole equity new layer that was going to go on to moving into tiers, I was very, very concerned that we would not get into red first, because getting into red opens up a lot of opportunities. And we can stay in red and live very comfortably as long as we continue to do the important things of wearing a mask when you're out around other people in close contact, washing your hands frequently, not going out when you're not feeling well, continuing to take these very important precautions anyway. So the fact that we're in the red tier, and I will add one more thing about the equity provision, the equity provision will not cause us to go back to another tier. So we're in red. If we don't meet these equity numbers, it won't move us back into purple. It will, though, slow us down potentially for moving into the orange category. So with red, retail businesses are now able to open up to 50% maximum occupancy rather than 25%. So those of you who are waiting in line sometime at your favorite grocery store or your favorite boutique, that's going to lessen that up. We were very excited to see restaurants and museums can operate indoors at 25% occupancy. And that's great. We've got some wonderful smaller museums, both in San Ramon and Danville, historic museums that now can be open to visitors on that scale. And of course, the beautiful Blackhawk Museum up in Blackhawk, which has great capacity, they're now able to open up at 25% capacity as well. Places of worship, movie theaters can now open at 25% capacity, or up to 100 people, whichever is the lower amount. Again, this opens up more opportunities. Indoor gyms, 10% occupancy. And I know our gyms have been really preparing for this. It doesn't sound like a great amount. We'd love to be at 40 or 50 or ultimately 100%, but 10% is a great start. all personal care services now, including massage, can move indoors. Indoor shopping malls can be open at 50% of their maximum occupancy. Libraries have the ability to open up at 50% maximum occupancy, but right now the county library system is choosing to stick with their front door service through the rest of 2020. They're still concerned about the risk to patrons, the risk to library personnel if they open up, and the ability to keep everything as clean as you would need to. Because with all of these openings, it's not like you just open your door and you just go in and you don't have to worry about anything. There are some very, very strict state guidelines that need to be followed with regard to sanitizing areas, with regard to space between patrons, with regard to, even in a restaurant, how you handle the silverware, how you handle the menus, things like that. Higher education institutions can actually resume indoor lectures and student gatherings at 25% occupancy. So that's our colleges, universities, or 100 people, whichever is less. And so, of course, that could have ramifications for DVC. St. Mary's College is the one college where we have people actually living in dormitories. They have been following a very slow, measured approach to reopening and have very good guidelines in place. We're not very concerned about a major outbreak taking place there because they have these very cautious guidelines. I'm sure many of you are seeing across the country as colleges and universities have welcomed students back. We have seen some really, really incredible, surges in these college populations, because even though on campus they're required to wear masks and appropriately social distance, in their apartments, in their dormitories, that's not always the case. And the sad trend we have seen, and our health officer has acknowledged, is that oftentimes in these communities where you have returning college students, about 2 weeks after that surge of college students, you start to see a much wider spread in the community. And so that is a disconcerting trend we're seeing. Again, for Contra Costa, it's not a serious concern, just given where we are with everything else. Now, public schools, or all schools, not just public schools, once we're in the red tier successfully for 2 weeks, have the option to reopen. And again, you still have significant guidelines, and I know our school board in the San Ramon Valley Unified School District has really, really grappled with this, of what's the appropriate way. I have great respect for their decision making in this, and I think they've got to make what they believe is the best choice for the students in our community. Like the rest of you, I'm excited to have playgrounds open too. It was hard to keep children off of them. And as a grandmother, taking my children through a park saying, no, you can't get on that playground equipment. I don't care if all the other kids are on it, it's illegal. It was not easy. For parents who are concerned, bring your sanitizing wipes in your diaper bag with you, wipe things down if you're concerned. But following those rules, I think, will keep everyone very much safe. Now, as I mentioned, it's still in the community. And so San Ramon, I always love to give you your update. In the last 14 days, you've seen even more cases than you did last time I was here. So you've had 37 new cases in San Ramon. You are up to a total of 352 cases, which comes out to 423 per 100,000 population. In contrast, your neighbor to north in Danville, they've seen 33 cases in the last 2 weeks. They're up to 310 cases, but given their smaller population, rather than your 423 per 100,000, they have 707 per 100,000 cases. Alamo has seen 11 cases in the last 2 weeks, bringing them to 108, but given their even smaller population, they're even higher than Danville at 732 cases per 100,000. Deaths throughout the county, people are still dying, although at a slower rate than we were seeing when we saw that surge through July. So sadly, we've had 200 people die in our community. 110 of those were long-term care facilities. And so as I've been mentioning the last few times I've been here, whereas back in May, 70 to 75% of the deaths we saw were in long-term care facilities. Right now, overall, it just makes up 54%. In the last 2 weeks, the deaths we've seen, 77% of those have been in the community as opposed to a long-term care facility. We continue to be worried, as we talked about extensively 2 weeks ago with Dr. Joseph, about the double surge of flu and COVID, overwhelming hospitals, could have both at the same time. Symptoms are very similar. Continue to recommend you getting flu shots. We are at some of our county testing sites offering you the opportunity to get a flu shot with your COVID test. San Ramon is one of those sites. So make an appointment to do both. It would be great to get them both taken care of. Halloween, again, use common sense. Guidance for doing it safely is on the county's website. I think, the idea of decorating the outside of your house, having neighborhoods walk around looking at each other's homes is much safer than knocking on doors and coming in close contact. We do not have an ordinance prohibiting it specifically. We just expect all of you to use really good common sense as you go through it. We continue to see, as I said, the trend for surges in other parts of the county, but overall, we're working very, very hard in those communities to address those. So with that, Bill, I'm going to cede my extra 4 minutes you gave me to Dr. Joseph or to any questions you or anyone in the community may have. We're excited to be in the red tier. We're going to be here for a while, but it does give us many, many more opportunities. And, as we all know, none of us have immunity to it. Even the President of the United States and his wife, Melania. So, be careful out there.
I'll start off with a question for Supervisor Andersen. What's the current turnaround for COVID-19 tests at county sites?
Fortunately, we are turning them around in 2 to 4 days. And so encourage you to get tested. Built into that tier metric is if we have more widespread testing, we get sort of a bump up, sort of a credit for that, because we are able then to identify cases quickly. So even if you've been tested before, if you've been out in public, every 30 days you can go to a test. We have also worked closely with our providers over this last month. I mentioned it 2 weeks ago. So the Kaisers, the John Muirs of the world are getting more willing to allow people to get tests even without seeing a doctor first. And so we encourage you to keep getting tested, but our county test sites, they're available and your insurance will be billed in essence, it's generally no cost. You might get a small bill from your own insurance company or something. So, but the turnaround time, because of the new contracts we entered into, significantly has improved our ability to turn those around, which again, I didn't even go into contact tracing, but we still are reaching right now about 75% of everyone who tests positive. We are able to reach them through our contact tracers. And of course, this is such a critical component that people know they need to self-isolate as soon as they realize that they do in fact have it, because people are still asymptomatic and they may not know they have it and they're spreading it to others.
And as a follow-up question to that, if you get a flu shot vaccine or flu shot at the county-run COVID test site, will insurances be billed?
I believe they will for both. Flu shot, I'm not sure, and I'm happy to check on that if someone wants to email my office. We're calling our flu shots free. They may in fact be actually free, but in most cases, the county bill you. If we bill your insurance company, the insurance generally will pay for it, and most insurance does cover a flu shot as well.
I also want to comment that if you are a Kaiser patient, the new facility in Dublin along 580 has a drive-through flu shot.
Right.
For that, and I just got mine on Wednesday, and it was about 20-minute wait, so it wasn't too bad. They make sure you put your car in park and turn off your engine, because I asked them, so what happens if somebody has a little problem with the shot and kind of faints? But they have that all figured out, so no problems there.
Or bring a designated driver if you're gonna. I have some fainters in my family, and I'd say those people bring a designated driver.
Yes.
That was a concern from my former days working in an ER. I saw people kind of hit the deck on some of these situations. So a question for Supervisor Andersen: is there a scenario where Contra Costa County would move backward into the purple tier?
Yes, there is. Now, unfortunately, if our numbers were to spike in the wrong direction, countywide, not just in disadvantaged communities, we could end up back in the purple tier. And so again, that's where it goes to. We're moving in the right direction right now. Our hospitalizations, we're down in the low 30s again, whereas in July when we saw that surge, we were in the low 100s. everything is indicating that we're going to be okay. But I'm crossing my fingers, because I was telling you that back in May, when we had these timelines for reopening, and we all felt very confident. So my message really is, don't let your guard down. Don't throw a big backyard bash, or worse, an indoor bash in your home. Use common sense. The virus is among us, and we don't want you getting sick. And yes, some of you will have zero symptoms. Some of you will not be impacted at all, but others really will. And that's what we do not want to see. We do not want to see a surge in hospitalizations. We don't want to see our hospitals overwhelmed so that people unnecessarily die, because we do have really good treatments. So it really is, it's looking out for one another. Wearing a mask is the best thing you can do for your fellow man and yourself.
And a follow-up, Candace, what are the county rules on wearing a mask outdoors?
We still have a mask ordinance in place. And so again, if you're going to be within 6 feet of someone, you should have a mask on. If you're just walking outdoors by yourself and you're not coming near, you don't anticipate close contact, keep a mask in your pocket that you could flip on if you're going to see people. But when you are outdoors, and when you are entering stores, when you're entering buildings where you're going to be around other people, even in a work site where you can't be 6 feet apart, you need to have a mask on.
Well, I have a question of Supervisor Andersen.
Sure.
and I'm not trying to put you on the spot with this, but you casually mentioned that individuals can go to John Muir and be tested without a doctor's order.
Well, no, I said Kaiser is working toward that. We're trying to work with John Muir to get them to do it as well. So I apologize. I do not believe, I've not had confirmation that John Muir is. We've been working with them, with our other health partners. I know Kaiser is now allowing that. So I apologize. I may have misspoke on that.
Well, let me tell you my understanding of this and how we have worked around it. In California, a laboratory test, it requires a doctor's order or a doctor's designee. That's not true in all states. In Arizona, an individual can order their own blood tests. But in California, it's still that way. My understanding is that the county sites bypassed that by saying, this is an order from Dr. Farnatano. You can go to a county site and get tested without having a specific order of your private doctor. And that's fantastic. I favor testing, and I would love to see us find all sites being able to provide testing without a specific doctor's order. Now, there's complications with that. I recognize them. What do you do with the results? But if we can do it at a county site, I am a proponent of doing it at all sites, making testing widely available, like we have for HIV disease.
Well, and that's a good point. I think that it's something I'm going to bring back to Chris, to Dr. Farnatano, saying, could our health order be crafted in such a way that says you do not need to have a doctor's order to get a COVID test, which would then open it up? I understood it was more barriers from medical providers. Again, these tests, they're not free. They do cost money, and they've been at various times in limited supply. And I can understand why medical providers are concerned that they want to save those tests for those who truly need it, and not just for anyone. But that's something I think is worthy of a discussion, or if it's state law. I've got a great state delegation with Senator Glazer and Assembly Member Rebecca Bauer-Cahan, who I think would be very anxious to change state law to allow that, if in fact that's one of the barriers to testing.
Well, I believe that would be a move forward. They certainly have for HIV disease. Anyone can be tested for HIV disease anonymously or by giving their name. The results go back to that individual. Reporting, I assume that you've already handled all the reporting problems because you're doing this at county sites without a specific order. And
we have a health order that mandates anyone who administers a test to report it to the county. And so we have handled that aspect early on back in March and April, because we very much needed those statistics wherever they were being gathered. So I'll have to talk to Chris about that and find out if there's something more we need to be doing to facilitate it. I think with our hospitals medical professionals, we work very, very closely with them and with the hospital council. And I think what we're going to see too with the vaccine, which my understanding is it has to be refrigerated. And so it's going to be, as we work on rolling out the vaccines, we're going to need to be working closely with our hospitals because they have some of the best and largest refrigeration capacity to administer the vaccine. So it's a great partnership we have and will continue to have.
Thank you.
And I don't know if Supervisor Andersen has this information offhand, if there are any current COVID hospitalizations at San Ramon Regional. I know, oh, go ahead.
No, I was going to say, you can go onto the state's data map. And if you just Google COVID hospitalization, state of California, there is a data map. It will show you a scatter graph that shows you a map of the county and where COVID patients are hospitalized. And you can guess where they are. Because of HIPAA, we do not detail how many individuals are at each hospital. To date in San Ramon, you've only lost 2 individuals to death at any given time. There have been people hospitalized here, but go to the state's website and you can see that information right there of where those patients are hospitalized.
And just because they're hospitalized in a particular hospital does not mean they come from that community.
Not at all, no. And early on, we were seeing many of our patients showing up in Alameda hospitals, county residents, because out in West County, that's where they receive their hospital care. And as we saw significant surges down in the South State, as I mentioned early on, we were getting some of those patients transferred to our local hospitals. And then of course, when San Quentin had the outbreak, we didn't get those patients, but San Francisco, Marin were overwhelmed with some of those patients.
Exactly.
So